So our next item on the agenda is a resolution in support of National Suicide Prevention Month. Can I get a motion with respect to this resolution? All right, Kristen, go ahead.
I move that the board approve a resolution in support of National Suicide Prevention Month.
Can I get a second? Looks like Carolyn. Would somebody like to read the motion? Looks like Jim would like to do that. Go ahead.
Yeah, I'd be happy to. In support of National Suicide Prevention Month, September 2023. Whereas suicide is the 10th leading cause of death in the United States and the second leading cause of death among individuals between 10 and 24 years of age. And whereas, according to the Centers for Disease Control and Prevention, one individual in the United States dies by suicide every 11 minutes, resulting in around 48,000 deaths each year in the United States. And whereas it's estimated there are approximately 1,400,000 suicide attempts each year in the United States. And whereas reducing the stigma associated with mental health needs and suicidal thoughts and behaviors can encourage individuals who are experiencing these issues to seek life-saving help. And whereas schools are an important setting for supporting suicide prevention, educators, mental health providers, and all other school staff play a key role in keeping students safe. And whereas, according to the Morbidity and Mortality Weekly Report for the Centers for Disease Control and Prevention, risk factors for suicide, such as anxiety and depression, have increased considerably since the onset of restrictions to help slow the spread of COVID-19. And whereas September is an appropriate month to designate as National Suicide Prevention Month because September 10th is World Suicide Prevention Day, a day recognized internationally and supported by the World Health Organization. Now, therefore, be it resolved that we, the Poudre School District Board of Education, support National Suicide Prevention Month, September 2023.
Thank you. Pardon me. Thank you, Jim. And I believe we have someone here to speak in support of this resolution. Is that correct, Brian?
Yes. Joining us this evening to speak to National Suicide Prevention Month are our Mental Health and Prevention Coordinator, Ms. Sarah Mauder-Wilkins, and Lead School Psychologist, Brittany Hudson. Welcome, both of you.
Thank you, Board, members of Cabinet, and Superintendent Kingsley. It is a privilege to have time to talk to you about this important topic tonight. I am Sarah Mauder-Wilkins, Mental Health and Prevention Coordinator in PSD.
And I'm Brittany Hudson, Lead School Psychologist. As you are probably aware, suicide among children and adolescents is an issue that touches the lives of far too many of our PSD students, families, and schools. Despite disheartening statistics, however, we know that there are some circumstances we can directly impact to reduce suicide risk. Every day, our school-based mental health teams work together to identify and implement strategies to reduce the risk of suicide in our school communities. Individually, our staff support development of effective coping and problem-solving skills, foster attitudes of acceptance, promote connected, healthy relationships with peers, family, and trusted adults, and reduce access to lethal means.
While we've discussed some sombering statistics today, we also want to take a moment to highlight hope. We are excited to share and celebrate what PSD's mental health special service providers, consisting of counselors, mental health specialists, school psychologists, and social workers, have collaborated closely on to support suicide prevention in PSD. In the past year, our school-based mental health teams have provided required trainings for all new employees in QPR, an evidence-based program that helps all staff recognize warning signs of suicide risk and informs them of who to go to for support. We're training new staff at higher rates than ever before through our monthly new employee orientation. We have provided opportunities for bilingual staff members to become certified QPR trainers in order to make that material accessible to students and families in their native language and from folks with whom they identify with culturally. We have partnered with the Alliance for Suicide Prevention to provide community and parent-guardian trainings in QPR, as well as suicide prevention trainings for students. We have trained 185 counselors, mental health specialists, social workers, and psychologists in an aligned, research-based suicide risk screening practice. Our new model of suicide risk screening allows for increased collaboration between mental health professionals working together and more trained professionals in our schools than ever before to support students and families in moments of need. Through grant funding, we were able to distribute 250 lockboxes to mental health SSPs, family liaisons, early childhood staff, and school resource officers to give to families to reduce access to potentially dangerous items in their home. We've partnered with the Juvenile Gun Safety Coalition to distribute materials on safe gun ownership. We also supported a campaign where student voices were helped to destigmatize mental health struggles and encourage seeking support.
Supporting students' mental health and well-being truly takes us all. We have highlighted some of the more visible interventions and collaboration among our mental health professionals to keep students safe from suicide. But everyday actions like the hello in the hallway, the coach checking in with the athlete, a club meeting a student looks forward to all week, the parent asking their child how they're doing, the social emotional learning lesson on problem-solving skills, and many more small but powerful and meaningful acts increases connection, mitigates risk, and builds upstream suicide prevention.
All of this work within the PSD community, paired with the dedication of our school-based mental health professionals, is critical in continuing the journey towards positive mental health outcomes for our students. We appreciate the supports of these efforts by our board and our district leadership and families. Thank you.
Thank you. Jill, if we could have a vote on this resolution, that would be great.
DJ Anderson,
Aye.
Jim Brokish,
Aye.
Nate Donovan,
Aye.
Kristen Draper,
Aye.
Rob Pedersen,
Aye.
Carolyn Reed,
Aye.
Jessica Zamora.
Aye.
Motion passes 7-0.
Thank you very much, Jill.